Hi everyone, welcome back to the channel. I'm so glad you've joined me today for another important health talk. If you are new here, don't forget to like this video and subscribe for more medical content that's simple and straight to the point. Today we're talking about something very common but potentially dangerous: gastroenteritis. So, what is gastroenteritis? Gastroenteritis is an acute inflammation of the stomach and small intestines. It usually comes with two very unpleasant symptoms: diarrhea and vomiting. Basically, your digestive system is not happy at all. Now, let's talk about what causes it. Some of these might surprise you. Acute alcoholism. Yes, drinking too much alcohol can irritate the stomach and intestines. Overindulging in spicy foods, especially if the food is contaminated with bacteria like salmonella. Antibiotics. Some broad-spectrum antibiotics like ampicillin and tetracycline can upset your gut and cause this reaction. So, you see, it's not always about catching an infection. Sometimes we trigger it ourselves. When it comes to signs and symptoms, you need to look out for severe diarrhea and vomiting. This is usually the first sign. Then there is colic pain. That's the crampy stomach pain. There is rapid dehydration, and this is dangerous. Sunken eyes and sliding cheeks. These are signs that the body is losing too much fluid. Inelastic skin. Try pinching the skin. If it doesn't bounce back quickly, it's a sign of dehydration. Cold and clammy skin. So the body is trying to cope when there is this. Then in children, watch out for depressed fontanelles, that soft spot on a baby's head that sinks in when they are dehydrated. If you see these signs in a child, especially sunken eyes or a soft spot sinking, get help fast. Now to treatment. How do we help someone recover? First, we replace lost fluids using IV drips. For example, normal saline and Ringer's lactate. If a stool test shows which organism is causing the illness, we treat it based on that. It could mean giving specific antibiotics or antiparasitic drugs. If not treated quickly, gastroenteritis can cause serious problems: severe dehydration, kidney failure, heart failure. Now, heart failure comes about because the body lacks enough fluid to pump blood properly. That's why we take it seriously, especially in children and the elderly. Here's what proper care involves, whether in hospital or at home. Strict isolation. Keep the patient away from others to stop the spread. Barrier nursing. Gloves, aprons, hand hygiene, all must be followed. Fluids, 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 whether IV or oral. We must keep replacing the lost fluids or the lost water. Fluid balance chart helps track how much is going in versus how much is lost. Check vital signs every 4 hours like temperature, pulse, blood pressure. Encourage oral fluids once diarrhea improves. Then give oral care because vomiting leaves the mouth dry and sore. Skin care should be done to prevent bed sores, especially in weak or elderly patients. Clean the skin after each bowel movement to prevent rash or itching. Also encourage hand washing. Now, this is key to stopping it from spreading. It's not just physical care. We must also support the patient emotionally. Reassure them. Let them know you're doing everything to help them. Explain what you're doing because it reduces fear. Ask them what they think caused it because this helps with prevention. Let's talk about prevention because most cases of gastroenteritis can be avoided. So advise the patient and family on personal hygiene. Cut nails short, wash hands after toilet and before eating. Avoid leftovers or store the food properly in the fridge. Boil drinking water, especially in areas where tap water may not be safe. Avoid alcohol, especially if they've already had an episode. Okay, and that brings us to the end of our session on gastroenteritis. If you found this video helpful, please give it a thumbs up, subscribe, and share it with someone who might benefit. Until next time, stay healthy and keep learning. Bye for now.